Amazing. So I want to say the biggest thank you, I think, of any guest for coming on so far, because you've flown in just for the podcast, which I can't explain how grateful we are. And specifically because, as we mentioned off air, so I apologize in advance for almost embarrassing you a little bit again, because I know you might not admit it, but you have the most incredible qualifications list I think I've really ever seen from my standpoint in terms of being able to deliver a very holistic and well-rounded approach to health and well-being, which is why I'm incredibly grateful to have you on the show today, and I can't wait to get into this conversation with you. So Dr. Kerry Ashton, thank you so much for being here.
Okay, no, thank you for having me in to chat today. I'm just really pleased to be here, so yes.
Amazing. Yeah, this is going to be a great episode because, as I said, your background kind of coming into the medical world, but then the qualifications you've done since, I think, are going to give us such a unique perspective on some of the issues that we're going to talk about. But let's obviously set that tone and go right back to the beginning. Tell us a little bit about yourself and your background and how you've ended up where you are today.
Yeah, so I'm a medical doctor. I am a consultant in rheumatology, and I suppose I've done most of my undergraduate and postgraduate training in Northern Ireland. So that started quite a long time ago, back in 2002, and I did my 5 years at university. Then after that, as you know, the medical training process is quite long, so we tend to work through different specialties. So I've sort of spent time in A&E, cardiology, surgery, general medicine, and even a bit of psychiatry at some stage as well. And then in the later stages of your training, that's when you start to specialise. So I spent those last number of years of training really focused on rheumatology. So rheumatology, that's really the sort of diseases that affect the muscles, joints, tendons and connective tissue, and they can be degenerative or autoimmune in nature. So I suppose that all finished around 2017, and at that stage my husband, who is also a doctor, was doing a fellowship in Canada. I went with him. And I suppose, if I'm honest, at that stage, I was probably a bit burnt out. I felt that I had worked so hard for so long, and it was all a bit of an anticlimax. I just wasn't quite sure that this was really what I wanted to do or how I wanted to practice. So I ended up just taking a bit of time out. That's when I coached in a CrossFit gym. So I did my CrossFit level 1 and worked in a gym in Edmonton then. And I also did some further training in sports and exercise medicine as well. When we came home then, I think I did fall back into that kind of familiar trap again. I did some locum consultant work in the Belfast Trust, and then actually took a post in an NHS hospital in Taunton in Somerset. So I was travelling backwards and forwards for the last 2 years. And really over that time, I still, within the NHS, felt that I wasn't really doing the best that I could to help people. And that's when I started to look sort of outside the more traditional sphere and really look at sort of functional medicine and did some training and modules within that as well. So that's kind of my background and where I am now.
Yeah, that's amazing. And I think those modules in the functional space, there was quite a few as well, wasn't there? Bioenergetics, endocrinology. You're very, very well-rounded amount of research.
Yeah, so those modules, they're excellent. They cover such a broad range of different conditions. And, some people maybe think functional medicine, it's a little bit out there, but actually their stuff, it's all evidence-based. It's all sort of research-based. And I think, those of us who, come from a medical background, we use all of that information really well and try and combine that with the more traditional sort of medicine as well.
Yeah, no, I love that. I would love to understand at what kind of point in your, I guess let's call it traditional medical career, you maybe went, okay, there's maybe something missing here and I need to learn some new information or some new skills in a slightly different area.
My specialty, rheumatology, it's very clinic based, so I spend a lot of time in that outpatient setting, and so many of those conditions that we treat, so rheumatoid arthritis, psoriatic arthritis, osteoarthritis, they're all classed as chronic conditions. And when we think of chronic disease, it's also those other things like cardiovascular disease, hypertension, diabetes. And chronic disease is just so common. Up to 80% of us are going to have one chronic condition by the time we're 60.
Wow.
Yeah, it's huge. Up to 60% of us are going to have more than one by that stage. So it's just so common, we're starting to think of it as normal. So what happens then, you come to your rheumatology clinic and we start talking about your joint pain or whatever else it is that you're seeing me for. And when we delve into your medical history, you start to discover that it's not just one thing. These patients usually have a list of other problems. Okay, so they come and they've maybe on medication for their diabetes, their thyroid, they've got hypertension, they've maybe seen a cardiologist at some stage and had maybe cardiac stents. Sometimes there's a history of cancer, and sometimes people are overweight as well. So it's not just one thing. And quite often they've seen many other specialists. So I think the thing is we all tend to work in silos. You see a cardiologist for your heart, you see a hepatologist for your liver, you see a rheumatologist for your joint disease, and no one ever just stands back and looks at everything as a whole. So I think you come into the rheumatology clinic, and if you have a autoimmune or inflammatory condition, what happens next is that in addition to all of the other medication that you're on, we then start this sort of cascade of really potent immunosuppressants that you're going to be on for life, okay? And, we have so much wonderful research in all of these drugs, and in that setting, they seem to work really well. But in clinical practice, what I felt was there was a very small number of people who have a good response. So in a few people, these drugs are life-changing, but in so many people, you see this partial response or a non-sustained response. And then there's another group of people where nothing seems to work. So we keep throwing things at them. We give them an anti-TNF, we give them an IL-6 blocker, we give them some medication that's going to destroy their B cells. But despite that, they've got this ongoing chronic inflammation, and we never get them well. We never get them back to full health. So I always felt like we're missing something. There's something that we're not addressing here. And I think the way that we practice within the NHS, it's very reactive. We wait until people are sick. We wait until people are desperate before we intervene. And this is something that CrossFit do talk about quite a lot. They have their illness to wellness continuum. So you have optimal health at one side and you have chronic disease and ill health down the other. And we don't just jump from one end to the other. This is a gradual process. So it takes years, sometimes decades, before these chronic diseases emerge. And I think there is this tendency sort of when you are in medicine, that when people come to you with symptoms and symptoms that maybe don't quite add up to a disease, something that doesn't fit nicely into a box, that quite often we just say, oh, there's nothing wrong, or come back, when there is something wrong. And that just leaves people sort of really struggling, and they don't really get the support and things that they need at that time. I think sort of what I realise as well is that this is sort of really applies to women as well. I think women have a much more difficult time sort of in this sort of traditional sphere. When we look at all of our sort of guidelines and treatment strategies, we are living in a world that's been designed for men. All of these things have been studied, tested and designed with men in mind. And even if you think about a heart attack, so those classical symptoms of a heart attack, that's that central crushing chest pain that radiates to your left arm. So those are sort of the classical symptoms that a man presents with, but quite often women do not present like this. So they may not have pain, they may have pain elsewhere, they may just have some nausea, vomiting, some sweating, or they might just feel very fatigued. And because those symptoms are not typical of a way a man presents, they're called atypical. So like, we are not atypical. We are over 50% of the population. We are women and we deserve better than this. And I think just because we are so complex, we have periods, we have babies, we go on the oral contraceptive pill. Because of all of that, we've been left out of those medical studies. So we're taking evidence that's been sort of tested on men and applying it to a really different population. And I think that just leaves women struggling. They're struggling with symptoms and quite often just made to feel like, it's all in their head, or they just have to accept this as getting older. And that's really what I want to change. So I just don't feel that, feeling fatigued, having chronic pain or crippling PMS, these things aren't normal. These are your body's distress signals. They're letting you know that something's wrong. This is the early stages of chronic disease and we need to do something now. This is our opportunity to intervene and get you back on the path to optimal health.
Hey, it's Leo here. Just very quickly interrupting this podcast episode to share with you a really exciting announcement. The Nexus team are now available to take on new one-on-one online nutrition clients. So if you're interested in working with myself or anyone on the team for your nutrition, health or body composition based goals, then follow the link in the show notes and you can see all of the information on what that might look like to work with us. I love that answer so much. I feel so
Sorry, it's quite long.
No, that was not only was that answer incredible, but you answered my next question, which was going to then be, what is the gender health gap? So how does everything you're saying translate into being a little bit different and a little bit worse ultimately for women, which you already answered? So no, that's incredible. So if you are one of these women that is experiencing chronic health issues, or you feel like you're maybe on the way, you're slipping a little bit, you've kind of alluded to how we maybe need to like zoom out a little bit, look at things from a more holistic standpoint, and as opposed to those like specialist individual departments. So if a woman comes to you and she is experiencing, you've just said like, PMS, other maybe menstrual cycle related issues, where do you start in terms of like, consultation, testing, analysis with that woman?
Yeah, so I think we just need to step back and really take a really holistic, broad view of everything. So I think when you go to a traditional medical clinic, we just very much focus on those symptoms and sort of that disease progression, but we never really look into your lifestyle, and we kind of pay lip service to things like, yeah, you need to eat better, you need to exercise better, but we don't really delve in and really sort of support people there. So I suppose when it comes to that, like I generally I have 2 sort of fairly in-depth questionnaires that people fill out before they come to me. So I'm trying to gather as much information about you and about everything that you do. So what you do on a day-to-day basis, what you work as, what your commute's like, what you're eating, what your training is like, and then all of those other symptoms. So your menstrual cycle, are you having PMS? So I really try and gather all of that. And then, I just don't think that seeing people in a 10-15 minute appointment is helpful. It's not enough time. It's not enough time to address those really complex issues. It's not enough time to make people feel heard as well. I want more than just, an 8-minute appointment. So we tend to have quite a long chat about things, and then after that sort of decide on what way things are going to go. So there are a range of tests that we can do. There are so many sort of standard like medical blood tests and things that we can check. I suppose really just depending on symptoms, are we going to look at one of the sort of endocrine systems? Is it your reproductive axis? So that is the issue. Is it your metabolic health? And then have a look at those bit of vitamin and mineral deficiencies that are really common as well. So I suppose that's where I start. Generally, even after a first appointment, I feel like we're only really starting to get into things. And really the way I like to work with people is over a longer term. So I like to see you back again and really help you try and progress with those lifestyle changes, and just really help you make changes that you're going to be able to sustain for life rather than a quick fix.
Yeah, that's incredible. I think I'm so happy with this episode and being able to, chat with you, because for a long time, I was kind of looking at like, I'd love to go to medical school. I really feel like I need that credibility and expertise. And then I've ended up obviously kind of doing, working with people more in the way that you are now, albeit obviously not with the medical background. So to be able to chat with you and hear kind of your journey from the medical background, the problems you saw with it, and now how you work with clients is just amazing to hear. So yeah, thank you for sharing that so far. One thing that I think would be really great to get into, because it's probably the most misunderstood word in the fitness industry, and considering this is what you specialize in, is what actually is the definition of inflammation, and why could this potentially be a part of the problem with some people's chronic health issues?
So like inflammation, it is sort of it's something that is a natural process. So if we have an injury or we have an infection, it's when our immune system gets stimulated and it responds to that stress. Okay, so we start a healing reaction from that. The issue is that when that inflammation becomes chronic, okay, so when there are things that are sort of upsetting the body on a long-term basis, that's when that inflammation starts to become a problem. So people who have chronic inflammation, your blood is a little bit stickier. It starts to cause damage to the blood vessel walls. It starts to cause damage to sort of multi-systems and organs. So really it's just, something that was supposed to be protective, but now is being chronically stimulated, and that's when it starts to become damaging.
And what kind of, if anything, lifestyle interventions can you, to go back before we even look at addressing it, I mean, what kind of elements of someone's lifestyle or nutrition are making this a problem in the first place?
Yeah, so there's lots of different things here. I think our nutrition is huge, and it's something that I am still, learning about, and myself, I've been on a huge journey over the last few years as well. But our health is a composite of everything that we do on a daily basis and everything that we sort of put into our bodies and the things that we are exposed to. So the biggest things, it's the sort of reliance on the ultra processed foods. So that packaged foods. If you're trying to decide if something is processed, just have a read at the ingredient list. If it's got more than 5 ingredients in it, or it's got ingredients that you cannot pronounce, it's a processed food and you don't really need it in your diet. Okay, so I think we're relying far too much on that type of food, and those are going to promote that long-term chronic inflammation as well. I think another thing that's really huge is stress. We're all so stressed out. You can see it when you're coming through the airport and public transport. Everyone is just like on the go all the time. And I think so many of us are stuck in that sympathetic activation, that fight or flight response. We've got that cortisol sort of banging away all the time. And I think that's a huge, huge problem for so many people. But sort of getting people to really understand that and really try and switch things off and make changes can be quite difficult as well.
Yeah, for sure. I think let's spend a minute there if that's okay, because I think when we strip everything right back, obviously the hypothalamus, it's the same starting point for the nervous system and the endocrine system, right? So a lot of these issues, as you say, are coming down to people being stressed. And it sounds almost quite simple, but it really is obviously the first. I kind of use the analogy when I'm coaching clients. We need to look at what is the first domino to push over, like what is the best place to start, and we push that domino over and it has a knock-on series of benefits to the other systems or areas of your body. And often that is focusing on stress and stress management. So I would love to know a little bit more in terms of, like, firstly, how do you maybe communicate that with clients, because it's often quite a hard message to get across. Often the feedback I get as well, but I can't do anything about it. So tell us a little bit more about stress, how that affects health, and what are maybe some tips or interventions that you give to your clients to help people understand that, and then maybe focus a little bit more on lifestyle and stress management.
Okay, so we think of stress, that's we have our nervous system, we have our sympathetic and our parasympathetic nervous system. Our sympathetic nervous system is our sort of stress response. Okay, so when we detect threat or we feel danger, we get sort of secretion of adrenaline and noradrenaline. That's going to stimulate the hypothalamus, and eventually we get release of cortisol. When we've got lots of cortisol in our system, it has physiological effects. So we always talk about fight or flight. So if you're getting ready to run from danger, it's the things that are going to help you run faster. So you get less blood flow to your stomach. So you're not going to be digesting food at this time. The blood flow is mostly directed to your muscles. It puts your blood pressure up, your cardiac output up, your respiratory rate up. So it's prepping you to, you're on edge. And then once the threat is gone, the reverse of that has happened. Okay, so we're supposed to get parasympathetic activation and everything's supposed to come back down to normal. But I think so many of us, we are just living in this state of chronic stress, and so many of the things that we do day to day are stressful, and then we're adding more stress or on top of that with our food choices and things as well. So we're really stuck in that sympathetic drive all of the time. As I say, it can be difficult to sort of broach this with people. People don't like being told that they're stressed or that it's, a problem. And sometimes I agree, if you are, you're a busy woman, you've got kids, you've got a demanding job, maybe you've got parents to look after as well. It's hard not to be stressed, but there are times when you just have to put yourself first as well.
Yeah.
So I suppose really I am quite practical about these things. And like, this is something that I do myself when, I feel like I'm starting to get stressed. I look at the things that in my life that are causing me stress that I don't need. Okay, so there are things in my life that cause me stress that I can't do anything about. But there are also other things that I let into my life that make things worse. So things that make things worse for me are, things like reading the news a lot and getting very worked up about things like that. Spending a lot of time on social media. And what I really try and get people to do is cut down on those external influences. And even just really sort of straightforward things like, if you are really busy throughout the week and you're constantly answering emails, answering your phone, checking your phone, we really try and just separate things out and time batch things, if that makes sense. So like, you don't need to be on your phone all day, every day. If you're checking your emails, you dedicate half an hour in the evening time where you sit down and you sort all of that out, and that lets you, the rest of the time when you're at work be sort of uninterrupted, you're in that state of flow, and you're really concentrating rather than being constantly interrupted and adding more stress in that way as well.
I think that's such great advice. I absolutely love that. Obviously, we're here ultimately having a health conversation, and then most people probably going to think about nutrition and exercise, right? So the fact that we're here having like a stress and a social media and a news conversation, I absolutely love that, because that's so important. And without doing it on purpose, it's where several of the conversations on the podcast have ended. And you might have actually seen it. I posted, I think like last week, like 4 different guests' kind of opinions on social media inside one carousel, just because whether we're talking about stress or whether we're talking about relationship with food, gratitude, perception to other people's life, obviously social media does have the ability to really influence your nervous system. So I think that's such brilliant advice. Is that kind of part of your like onboarding screening process when you're working with a new client? You kind of ask them about their social media news habits, or how does that look in practice?
Yeah, so that is something that I would sort of dive into as well. And certainly it's something, so I really like to establish what people are doing in the evening time when they're getting ready for bed and things as well, because whenever you're stressed, sleep is something that really goes out the window, and something that really interferes with sleep is sort of the use of phone and social media and things sort of late in the evening time. So it's something I try and establish, see what your daily pattern is, and if I think it's driving things, we just try and set some limits around it. It's probably unrealistic to say just delete it. You don't need it, but let's just try and set some limits around it. So there's a set time of the day where you go on, you look, you let these things in, and then you put it away. Okay. And like Instagram, it's great. Everyone's, all happy all the time. We all have these perfect lives on Instagram, and so much of it is just not real. And we shouldn't be living our lives, thinking that, our life should look like that, because they don't.
Yeah. No, I completely agree. One little tip I actually do is I deleted the Instagram app from my home screen. So now I need to open the App Store and search for it. Yeah. Which doesn't sound like it would change much, but it's just that one extra step that creates that little bit of space between kind of that stimulus and response. And then it's just, I find myself opening the App Store, then I'm like, what am I doing? So that's useful. But no, so important. I think to take that back to female specific health, my understanding of kind of stress physiology is it impacts women a little bit differently, potentially from like an evolutionary survival standpoint, obviously the need to be able to reproduce. So I think that everything, when we're talking about stress, it can be a little bit worse for women's health, can't it?
Yeah, absolutely. And I think, our physiology is just different. I think women are just more sensitive to things like stress and low energy availability and things as well. So when you look at studies of low energy availability, even male-female comparison, so women run into difficulty when they go below 30 to 35 calories per kilogram of fat-free mass. Men don't have any problem until they go less than 15. So there's a big difference there in the way that we react to things. And I also think that women tend to hold more stress as well. I think we are, trying to live these perfect lives. We're trying to do so much. We take on sort of more responsibility, not more responsibility, we take on more roles, and we're trying to be everyone to everything. And there's a real tendency to put everyone else first and put yourself last as a woman. So I think definitely we take on more stress. But yes, those sort of physiological differences. So whenever our cortisol is high, when we're in that kind of stress response, it actually then is going to have effects on your estrogen and your reproductive access. Okay, so if you're stressed, it's going to make you sort of a decline in your estrogen. So it's going to have a knock-on effect on your reproductive access, your thyroid access, and all of that.
Yeah, everything. I guess even if you're not too bothered about it from a health standpoint, I know a lot of people listening are kind of into their training and performance, but obviously estrogen, anabolic, important for recovery. So times of high stress, I then imagine if I put 2 and 2 together, I'm going to associate that with in a woman like less ability to train hard and recover. Yeah,
absolutely. So even if you're talking about like overtraining syndrome, then that kind of stress absolutely comes into it. So if you're more stressed, you're more sympathetically driven, you've got more cortisol, you're going to be less resilient to stress. And I think we forget, because we enjoy exercise, because we're told that it's good for us, we forget that it is a stress. And when you're piling stress on stress on stress, yeah, that certainly has effects.
Yeah. How does that tie into low energy availability? I mean, that's obviously, you mentioned that a second ago. I think it's a really important concept, isn't it? That women need to maybe understand. So it'd be great to get a definition on the board, because as you said, men can definitely go lower before they run into problems. And I see that as an issue, because you've got at least 50%, but probably more like 60 or 70% of coaches are male, right? Whether it's PTs or whether it's like sports teams. So you've got a lot of guys going, or here's what the research says, or maybe they don't even read research, but here's what works for me. And then they're dieting and training women, but they don't understand this difference between the calorie requirements in terms of where things start to go wrong. So yeah, what is the definition of low energy availability, and what are kind of some like considerations of that from a dieting standpoint?
Okay, so low energy, I'll start with sort of what relative energy deficiency in sport is, and then sort of work back there. So that the red S syndrome is a sort of a physiological and or psychological sort of dysfunction, and it can affect anyone who exercises. And I think that's where the name causes a little bit of confusion, because when we say in sport, we think that only applies to athletes, people who are competitive, but this can happen to anyone who exercises, male or female. Okay, and really what happens? So I think that probably we're aware that it may affect the menstrual cycle, but you can have this problem with a normal menstrual cycle. So that's the really important thing to recognise as well. So it's a multi-system condition. It affects us in many different ways. So it can have effects on our immune health, our musculoskeletal health, and our metabolic health, as well as our reproductive health. So I think, any woman who is out there who exercises on a regular basis, and they are struggling with things like, fatigue, they are having difficulty sleeping at night, they're feeling like they're not coping with their training load, they may be picking up sort of more frequent infections or more frequent injuries. Those are all signs that you could potentially have, be in the red or be at risk here. And this really comes down to our energy availability then. So our energy availability, that is the amount of calories we have to fuel our basal metabolic rate after we take out what we have spent during exercise. Okay, so our basal metabolic rate, that generally sits between 1,300 and 1,400 calories a day. So for example, you are on a fairly low calorie diet, you're on 1,700 a day. You go to the gym and you're out and about all day, so maybe you've burnt an extra 700 as you're out moving around. That leaves you with 1,000 left over to fuel those basic physiological demands. So you're already about 300 or 400 short. And when we say those basic physiological demands, I mean, this is for everything. It's to keep your heart beating, to keep you breathing, to regulate your body temperature, and importantly, to make your hormones as well. So if you're not getting that enough energy in, that's when the body goes into that sort of energy saving mode. Okay, so it's deliberately shutting down. You get that sluggish kind of thyroid function. We get the increasing cortisol, the increasing sympathetic drive. And what that does then is actually increase our appetites. We're going to want to try and eat more. We're going to get more cravings, and it has a knock-on effect on our estrogen and things then as well.
That's actually really interesting. I'd never really quite appreciated that you could have REDS without any menstrual cycle dysfunction. I think without thinking about it this directly, just based on what I think I see with clients, I guess kind of assumed that there would always be some sort of menstrual cycle dysfunction if that was present. So that was actually really interesting.
Yeah, no, you can have a completely normal menstrual cycle and still be in low energy availability. And I think something else that you commonly see is maybe people who have quite bad sort of abdominal pain or abdominal cramps. They've been told they've got irritable bowel, but that can be a really common way for this to present as well. So anything that you sort of can't explain, anything unusual, it's certainly worth looking at further.
Yeah, brilliant. I think that for me then begs the question, if all of those issues are possible when a female is dieting, how do we set up a female for a successful fat loss phase if that is their goal? Which I know is a very open-ended question, but what would maybe some key tips be in terms of setting up a successful diet for a female that maybe we don't appreciate in the context of just normal dieting for a guy?
I think you have to be really careful with dieting and females, particularly females who are active. And generally, I suppose when people come to see me, they are generally struggling. They generally feel unwell. And yes, body composition is usually something that they mention, but there's so much else going on and their bodies are really quite stressed out that generally I would say that when you're in that state, you're probably not ready to be in a fat loss phase.
Yeah.
Okay. So if you have any of those things, say if you're not sleeping, if you sort of feel absolutely exhausted when you get out of bed in the morning, if you've any menstrual cycle issues, if you're feeling very stressed, I would say if you've any of those things, I really would avoid being in a deficit. Your body is under enough stress at the minute. The last thing it needs is you doing that to it. All you're going to do is drive that sympathetic nervous system even more. So I think generally my approach is I try and work with people over a longer period of time. We try and get you sort of stable again. So I generally don't do any diets to start with. We start off with 3 balanced meals a day, regular snacks, make sure that you're fueling your training. And when we have got your PMS under control and when you're sleeping well at night, then we can consider going into a tiny deficit. But say, I think you had done a post on this before about, the sort of minimum number of, macronutrient grams that women need per day to be healthy.
Reading.
That was, yeah,
I did.
So you have to be very careful. And I think, there's a temptation to go super low fat. All of our hormones are sort of derived from cholesterol. So if we're not getting enough fat in our diet, we don't have enough to actually make all of these hormones as well. So I just think for women, you have to be very careful. If you're not feeling great, if there's anything else going on, I would just say let's take it back, put you on maintenance until we get things back under control. I think if you've got those other symptoms, your body's just not ready to be in a deficit.
Yeah, I love that. I think there's, I first heard that concept from a mentor of mine, Luke Lerman, if you're familiar with Luke, many years ago, and he calls it a prep the prep phase. And I think I was probably like 19 or 20 when I first heard that. But for me, it sounds silly now, but at the time it was just such this big light bulb moment, epiphany moment, that it's like, hold on, sometimes a client might have a fat loss goal, but you can't diet them, because like being in a calorie deficit and doing more exercise makes everything better. And obviously now I'm like fully understand that that's not the case, but at the time I was just like mind blown. So yeah, I think that is it. Yeah, it's such an important takeaway, isn't it, that just because you have a fat loss goal doesn't necessarily mean you're in a position to diet.
Yeah, and I try and not talk about fat loss. I try not to talk about weight loss, but we're ultimately trying to sort of optimize body composition, but most importantly, just get you feeling well. I think so often we confuse health as something that needs to be painful. It needs to hurt. It's like this sort of punishment whenever we're starting a new health plan, and to me, health's just not that. Health is something that you can sustain. A healthy plan is something that's going to leave you feeling energized, strong and resilient, and not something that's going to make you feel worse.
Yeah, brilliant. I think even calling myself out on my own language, then obviously it is so important to use that language in your content on social media and with clients, right, to help kind of change that perception of we're doing this for body composition and to feel good as opposed to a weight loss goal. Yeah, I think that's brilliant. I think that I was loving hearing you describe the pre-diet phase so much. I actually forgot what my next question was going to be, but I know you wanted to touch on a little bit in terms of female specific health and maybe how the system isn't kind of set up to support that. I know we touched on that a little bit earlier. But yeah, and feel free to give a little bit more insight for the listeners in terms of why maybe the traditional system isn't amazingly set up to support female specific health, and what are maybe some ways that you can do to kind of advocate for yourself in that system if you do already have a chronic condition and you're looking for answers. Yeah,
so I suppose up until now, it's really only in the last few years we've started to really appreciate those differences between male and female health, and start to recognise that just because this is how a man presents and this is how you manage a man, maybe we should be doing something slightly different for a female as well. And I think for a long time we just didn't talk about these things. We didn't talk about the menopause, and I think maybe medicine as well, it's kind of a male-dominated world even still now, and that maybe people were a little bit dismissive of how much these women were really, really struggling to get help. So yeah, I hope that things are going to start to change. There's been so much more awareness and so much in the media about this as well. So I do think things are looking positive from here. But yeah, how to advocate for yourself. Just remember that your symptoms are real, okay? So you're the one that knows your body. You know when something isn't right. So don't let anybody else tell you anything different, okay? And when you're going into the doctor, practice what you're going to say. So it's really easy to get flustered and to feel intimidated whenever you go in somewhere like that. So practice what it is that you want to say. If you're someone who gets sort of forgetful or flustered, write it down, take some notes with you. That's absolutely fine. If you've got specific symptoms that you want to discuss, try keeping a diary for the few weeks before. It's going to be really helpful for your doctor.
Advice.
If you're able to say, this is how often they happen, this is how bad they are, this is how long they last. So that's all of the information that we need to try and help you as well. And so remember, it's okay to disagree with your doctor. It's absolutely fine. And if you disagree with them, just ask them to explain what, their reasoning. They should be more than happy to sit down and discuss that with you and discuss options. And I think lastly then as well, if you feel you're not getting anywhere, if you feel that relationship between you and your doctor is broken down, you are entitled to see someone else. So ask to see someone else in the practice or seek someone else out. But, just remember that, your symptoms are real. You deserve to be heard. You just sometimes need to find that right person.
Yeah, that's great advice. So you're telling me that hysteria is not actually a formal diagnosis and the reason that all women are going crazy. That's
I do feel a bit like that myself at times, but no.
I think that's actually a really interesting kind of little story and fun fact. I mean, if you're happy to share kind of why is a hysterectomy called a hysterectomy, and tell me about that background about hysteria and the diagnosis.
Yeah, and I think it goes back for a long time as well. Like, women have always been sort of slightly persecuted. If you even think about sort of the witch hunt trials and things, it was all kind of like these perimenopausal women, and they were probably starting to get sort of symptoms where they were feeling depressed and things like that as well. So I think for a long time that menopause has always been sort of treated as a time when women kind of like lose it a little bit, and that is sort of why we are quite dismissive of those things even now then as well. Yeah.
Yeah, wild, isn't it? I think that when you were describing that a minute ago, it reminded me, and I completely forgot. I put it on social media and I said, does anyone know the origins of the word hysteria? I believe it's partly Greek and Latin, I believe, and why kind of a hysterectomy is called that. And everyone was like, on a little poll, like, no, like, not heard that story. And I was just about to go to Ibiza at the time, so I was like, when I'm back, I'm going to do a post on that, and I completely forgot. So yeah, you've just reminded me. I'm going to get that done today, because that every time I think of that, it doesn't blow my mind any less that. Yeah, it's crazy, isn't it? So,
yep.
The question I was going back to the setting up a female for dieting success. The question I was going to ask is, obviously, metabolic rate does fluctuate a bit across the cycle, increases a little bit in the luteal phase. So, if a woman does have a cycle, because obviously not all women do you kind of change that diet, set up that diet approach at all across the menstrual cycle?
Yeah, absolutely. So we have the follicular phase, so that starts on day one of your bleed, and in this phase, this is when our hormones are low, so we tend to feel better, we feel a bit more energized, a bit more resilient during this time as well. And then as we sort of hit ovulation, that's when things start to change that little bit, so we get that big spike in estrogen, which causes the ovulation, and then into the luteal phase, those estrogen and progesterone levels gradually rise, and then if we don't become pregnant, they tail off, and that's when the endometrium lining sheds, and we're back to day one again. So yeah, that has big effects on our metabolism and our immune system and things sort of across that cycle as well. So as the body is preparing for pregnancy, so you're actively growing an endometrial lining. Okay, so your progesterone is high, so you're not focused on building muscle. It becomes harder to build muscle during this phase, and then because you're sort of like growing something, your metabolism picks up as well. So I generally do advise women, particularly active women, to increase their calorie intake by a couple of 100 calories towards those later stages of the cycle as well. And when you think like those sort of premenstrual cravings that you have, always try and tell women, like, these cravings are happening for a reason. Okay, they don't mean that you're weak. It doesn't mean that your character is fundamentally flawed. They're happening because you are, your body needs something. Okay, and it's telling you to reach for those sort of energy dense foods, because that's where you're going to get the calories that you need much quicker. So those cravings are absolutely valid, and that's why we increase the calories towards the end of the cycle then as well. I think there are just a few other changes as well. So there's differences in the way we kind of use different substrates for energy. So it becomes harder to sort of store glycogen and things towards those later stages of the cycle. So if you're someone who's doing endurance type training, really important that you fuel those training sessions. Okay, so if you're going on a particularly long cycle, take something with you. You're going to need to snack during that, because you're not going to be able to access your stored glycogen just so easily, and you're going to need to make sure that you refuel afterwards as well.
Interesting. Is that the lower estrogen and slightly worse insulin sensitivity because of the lower estrogen, or what's the reason for that?
Yeah, so whenever your estrogen is sort of unblocked by your progesterone, or not blocked by your progesterone, you're just able to use those carbohydrates much more easily. Whenever we kind of move into that later stage, we're kind of more sort of storing fat and things as well. So it's just, we're not able to access that and use it just so easily then. So we need to be taking more in at the time just to keep you topped up.
Yeah, interesting. No, that's really great advice. I mean, let's talk a little bit about exercise, if that's okay, because obviously you've got your other qualifications in that space, and that's a focus on your training. You actually mentioned earlier you just signed up for Ash Wisman's mentorship, which is super exciting to kind of offer an even better experience for in-person clients. So, which I absolutely love. Obviously, he's great and his course is great. So tell me a little bit about how you see exercise playing into this in terms of someone's health and lifestyle, but also what you mentioned earlier, which was really interesting, was obviously why they're experiencing pain. So yeah, how do you see exercise kind of fitting into this bigger picture?
Yeah, so exercise is, I suppose it's a difficult thing to balance. We have, one end of the spectrum where we can't get people to do anything, and then we have this other end of the spectrum where people are probably doing a little bit too much, and say we forget that exercise is a stress, and if we're doing too much and we're not recovering, we're going to run into issues with that as well. So I've sort of forgotten the question.
That's okay. So just what I found really interesting is, two things. So I think, again, as we've kind of alluded to, when you're coming from that like medical background, a lot of the time it's, as you said, it's like you just work directly in that specialty. So, but obviously exercise is important to kind of reduce inflammation and improve chronic pain. So I find that just, brilliant that you're kind of incorporating that with your clients. And then what you said earlier was really interesting in terms of if someone's experiencing like pain in their shoulder, there's a large variety of reasons why that could be. And you wanted to understand more about the exercise mechanics and anatomy side of that to kind of complement what you were already an expert in. And I just found that kind of really interesting. So obviously, as you said, exercise sits on this continuum, and some people are kind of doing too much, which is maybe nearly as or just as bad as doing too little. So what kind of role does exercise play in improving someone's health and reducing chronic pain and chronic inflammation?
Yeah, so when we exercise, our skeletal muscles releases IL-6, and whenever we're releasing that sort of myokine IL-6, that is actually an anti-inflammatory. Okay, so it does have direct anti-inflammatory properties. As well as that, like we are actively strengthening our muscle tissue. So as we start to age, we lose muscles. So our muscles start to atrophy, and particularly in women after the menopause, we start to lose about 3 to 5% of our muscle mass every decade as we go on. So if you're not exercising, if you're not giving your muscle a stimulus to grow and be strong, you're going to run into trouble later down the line. And it's like our muscle, not only is it really important for like our skeletal system or our sort of locomotion and protecting our joints, but it has sort of metabolic effects as well. So if we've got healthy skeletal muscle, that helps us to manage our glucose and our insulin sensitivity better. Okay, so we're actively, if we've got skeletal muscle that works well, we're able to soak up that glucose much better, so it can actually help with that sort of type 2 diabetes and chronic disease as well.
Yeah, super important. I think, why would you say maybe women in particular aren't quite as active or don't enjoy exercise as much as men? Because I believe the statistics in the UK, according to the government website, are 42% of women don't meet the minimum activity requirements. I believe it's only like 25 or 20-something% of men. So I mean, firstly, maybe in general, non-gender specific, why are people not loving exercise like me and you do? And what can we do to maybe try and help and support that? And then would you say there's any gender differences as to why maybe women aren't quite as active as men?
Yeah, I suppose it's tricky. And like, I don't think there's many people out there who wouldn't sort of know that being inactive and being sedentary is bad for your health. But there's still this resistance to it. And I don't know if it's an enjoyment thing, but maybe we're kind of lulled into this false sense of security. So people in their 40s, maybe they're a little bit overweight, but you think to yourself, I'm not as unhealthy as so-and-so, or, I don't have time to worry about that now, but I'll sort it out later on. And it's really important to remember that just because you feel okay now, it doesn't guarantee that you're in optimal health, and it certainly doesn't guarantee that you're going to be, well in 10, 15 years time. And I think as well that there's this sort of belief that our health is predetermined, that it's genetic, and we've really lost that sense of agency over our own health. You know, it's just something that happens to me. I have no control over this. But all of these chronic diseases, we know that if you make lifestyle changes, not only are they preventable, but they're reversible as well. So if you look at even type 2 diabetes, there's about 7 million people in the UK who have pre-diabetes. So that means they have abnormal blood sugars, but the blood sugars are not bad enough to be called diabetic. But when you are pre-diabetic, this is still causing you problems. So that, you know, prolonged period of time when your blood sugar is higher than normal is still going to be causing problems with your circulatory system, your heart, your nervous system, all of those things. So I think what I would say to people is, you know, we're just going to remember that illness to wellness continuum again. So we've got optimal health on one side and disease down at the other. We have this huge period of time where we're sitting in the middle. Okay, so you don't just jump from one end to the other. It's this time in the middle when we're pre-diabetic, when those things are starting to go on. That's when we need to intervene, and that's when we can make those really significant changes to our long-term health as well. So I don't know if it's to do with enjoyment, but I think it's just that lack of realisation that, you know, I can take control of my health, and the things that I do now are actually going to make such a huge difference later down the line. I think if we could really get that message across, I think that would help.
Yeah. Do you think, I think that's such a, great advice, such a good perspective as well. Do you think part of the problem is that we set the bar and maybe the barrier to entry quite high in terms of what exercise means? Because my understanding of the activity requirements is that even a little bit of light to moderate activity goes a long way.
It does, yeah. Let's just do something. Doesn't matter. And if you don't want to go to a gym, that's absolutely fine. So, you know, any physical activity is going to count. So whether that is just going for a walk, doing the gardening, carrying your shopping home, all of those things are going to count. So the more you move, you know, the more that's going to help. So it doesn't necessarily have to be exercise. It doesn't have to be a really structured activity. Just get out there, move, do something that you enjoy and something that's fun. And every little bit that you do, no matter when you start, it's all going to add up and it's all going to make a difference.
Yeah, I think that's such an important message to communicate, isn't it? I think if you look, I don't know if you watched the Blue Zones documentary, recently came out on Netflix. I mean, pension fraud aside in those blue zone areas as to how old these people actually live, that aside, which, you know, is important. But I found what was really interesting in that is out of all 5 of those blue zones, none of them went, you know, there was no gyms in these areas. No one was going to the gym. They just had very, very active lifestyles through sport, through community, through gardening, through work. And none of them actually exercised in the traditional sense that we think of it in terms of going to a gym and doing a CrossFit class. It was literally just an active lifestyle.
Yeah, and I think that is just as important. It's really that being sedentary is the thing that's going to do the most harm. So let's just get moving.
Yeah, I love that. Do you have any thoughts on why there's potentially a discrepancy between genders and meeting activity requirements?
Yeah, and I think there are just huge differences between men and women the whole way through. And I think even this goes back as early as puberty even. You know, men hit puberty, they get more testosterone, they sort of put on muscle, they get strong, they get powerful. Women hit puberty and that doesn't really happen, so we get more estrogen and we don't have as much muscle mass. Maybe you start to put on a little bit of weight, and I think, you know, around that time your body's changing, you just don't feel as confident as you would, and you know, I think exercise becomes a little bit harder as well. So I think even right from the beginning there's those differences where women just don't feel as comfortable and as confident, and then as time goes on, like the less you've done, the less experience that you've had in the gym, you know, it's just a completely foreign concept and it feels like too much to get going. I really think what we need to do is, you know, start with working with these young girls, you know, at a much earlier age, get us introduced to strength training. Like I know even when I was at school, we did have a gym, but the girls didn't go there. The boys went there. Okay, so the girls didn't do any strength training. We went and did dance classes.
Yeah.
So we need to stop those differences. We need to get girls doing all of those type of activities sort of under supervision when they're young, build their confidence, make sure that they have the skills and the movement qualities that they need from an early age, and that's what's going to keep them going and more active in the longer term.
Yeah, that makes a lot of sense. I think as well, obviously women experience a few other potential life stages and complications or specific health issues, right, that men don't experience. So maybe if you're prenatal, postnatal, you're less likely to be able to exercise. If you're going through menopause, maybe that stops you exercising. Yeah, you know, women obviously maybe experience endometriosis, then you're in a lot of pain, maybe you're less likely to exercise. So men definitely have it easier from a life stage and diagnosis standpoint, don't they, when it comes to kind of reducing the barriers to fit activity into your life.
Yeah, everything is a little bit more smooth with a man. They don't seem to have those like sort of drastic transitions the way that women do. And certainly you don't get that hormonal fluctuation throughout the month. Yeah. So everything is just much more on an even keel. Yeah.
It's I really hope in 10 years time or so we look at those activity statistics and there's not really the same difference between genders. So that's the goal.
Yeah, and that everyone is doing a bit more, not just female, but we're all doing a little bit more.
Yeah, for sure. If you think of all of your female clients that you've got at the moment, what kind of like one message or one value or one bit of education would you absolutely, or one like mindset shift would you absolutely love all of them to just have today?
Yeah, I think what I see again and again is that we get this message from both the fitness industry and the medical industry that if we want to be healthy, we need to move more and eat less. And while that does apply to some people, it's a massive overgeneralization. And the less you eat and the more that you move, it doesn't necessarily mean that you're going to be healthier. So a lot of the women that I see, they really feel like they've tried everything. And when they say they've tried everything, they've done so many really drastic things. So they've, 1,000 calories a day, they've done keto, they've done low fat, they've done low carbohydrates. So they've really thrown themselves in the deep end and really punished themselves. And all of it tends to leave them feeling dreadful. So the message that I would like to get across is that if your health plan leaves you feeling awful, it's not healthy, it's not sustainable, and it's absolutely not necessary. So your health plan needs to be, we're trying to create a lifestyle. We're trying to give you something that you can do day in, day out for the rest of your life that's going to leave you feeling energized, capable, and just ready to tackle anything. So that's the big message. Yeah. That health does not mean that this has to be painful. Health is something that should be making you feel good, and that's what I try and get across.
Yeah, brilliant. If obviously you've gone on a really amazing journey with your own career over, a good few years of various different qualifications and expertise. If you could go back in time to, and you could talk to yourself as you're first starting medical school, what kind of one bit of advice or one thing would you say to that, Kerry, in terms of like, this is now what you understand, or this is now how you see health and fitness that you would love to have understood or be able to go back in time and kind of tell yourself when you're starting medical school?
Well, I suppose in terms of my own health and fitness, I did so many things wrong for so many years, and I fell into the same trap that I tell my women not to fall into. I suppose at times with the medical training and then trying to be fit and healthy on top, I really, really pushed myself into an absolute hole at times. So I think I would like to go back and tell myself that you don't have to do it all, you don't have to be perfect, and it is okay to take it a little bit easier on yourself. It's okay to take rest days. It's okay to relax. And all of those things are really important for your long-term health. And I think that if I had, taken it a bit easier on myself and relaxed a little bit more, I'd have been less sort of at that burnout stage really by the time I had finished then as well.
Yeah, which would have obviously been useful to preempt that, of course. Yeah, no, that's really great advice. We've obviously covered some amazing topics and lots of really, really important conversation points today. Is there anything that you feel like that we've kind of missed or that you want to add in hindsight to any of those talking points from today?
I'm not sure now.
That's fine. We'll go to the... Tell the listeners and viewers all of the amazing places they can find out more about you and the programs that you offer. And if that triggers anything in your mind, we can go back to adding any extra talking points.
So I am on Instagram as the Movement Medic. To be honest, my Instagram has been a little bit quiet of late, but I will try and get back on there again. I also have my own website, so themovementmedic.org, and I have just some information about my services and things on that. I am currently based at a CrossFit gym in Belfast, so I have a clinic room at CrossFit Berserk in Belfast, and that's where I can do one-to-one sessions, and I also do the movement assessments as well. But I can work online, so there are I can do online consultations, and also there are lots of different companies that will do blood work sort of remotely and things as well. So that really has opened all of that up to me. I'm sort of trying to move away from doing just one-off sessions, and I have a 12-week sort of Thrive for Life program, and within that what I'm trying to do is give you all of the education about how to work with your female cycle. We have a really good look at your nutrition, we have a look at stress management, we have a look at sleep, all of those things in 12 weeks that runs via an app. So there's absolutely loads of education on that, and that's really how I feel things work best. I think it's very difficult to make a lot of progress in a short period of time, and say health is for life, and this is something that's all just part of that journey. So I'm trying to get people onto that kind of 3-month program to really make those sustainable changes.
Yeah, no, that's brilliant. I absolutely love that. I think the fact that you're still, coaching in person, I just love that so much. Obviously, exercise and meeting people in person and creating an environment where someone can go and train and feel safe and have a good in-person experience, I think is such a valuable part of someone's health and fitness journey. So, yeah, I love that that's an option that you offer. No, that's amazing. And as for the Instagram, you'll have some incredible shorts in a few weeks' time. So that will get the Instagram going again. Thank you so much for coming on today. Again, appreciate it so much to fly over to come on and share those really important messages. I'm incredibly grateful. So yeah, thank you so much for your time, and I really look forward to getting this episode out in a few weeks.
Okay, no, thank you for having me. I've really enjoyed being here, and I hope that I have given some people some advice that actually helps. So yeah.
You have. That was incredible. Thank you so much.
Okay, thanks.
That was so good. If you've enjoyed today's episode, it would be amazing if you could do us a massive favour and leave us a review, and even if possible a comment. The reason why this is so useful for us is it allows us to know which type of content and which guests are best going to be relevant for you and your goals, so that we can continue to make the podcast even better for you in the future. Thank you so much so far for all of your support on the Women's Wellness Show.